So hello everyone, we are doing one proper discussion about the post-hair transplant care today. One of our patient agreed to share his basic queries and we are going to answer them one by one. He got his hair transplant 6 days back, so I can show you. So we have done 4500 grafts, 4521 to be specific. We have corrected his hairline area with a hair density. Then we have done gap filling. He was having many hairs over this area, and the crown area also we have filled with a good density. His donor area is right now in this condition. Okay, it's a 7 days. He came for the first hair wash at our clinic. Okay, so today his 5 to 7 days medicines are over. Okay, now he will be back to without medicines. How care and everything is expected to be done, that we are going to discuss now. He has some certain personal queries, so I will answer them and then I will explain the rest of the thoughts. Okay, so your age is 32. You just recently completed, I think, 6 days after its hair transplant. So overall, how was the experience? Everything is good?
Yes.
Okay.
I was expecting more irritation or itching, but because of medication, I guess it's normal, all good.
Okay. So you are covering your identity. We don't
Yeah,
know.
that's
We
okay.
will publish once you got full results. Okay, for your personal social life.
Yes.
So do you have any questions in mind at this time? After 7 days, what is the next thing you want to do or anything?
First thing about diet, that was already told. I have to reduce spicy foods, वगैरह.
Yeah.
But anything about proteins or carbohydrate, should
So
any requirement?
see, in diet part, I will say two things. Once you go through hair transplant, we give you antibiotics, painkillers, steroid, these kind of tablets, which are very heavy on your stomach. So many patients have digestion issues. Their stomach is already weak, and if they are taking these things, then definitely their flora will be weak. So the digestion will be weak. Okay. In that scenario, if you to eat too much spicy food or non-veg food or like which is not easily digestible, then it will might create you problem. So that's why for next 7 days after transplant we ask to avoid spicy and heavy food. Now the medicines are over. Now you can gradually resume your normal diet. You can take your spicy food gradually, little by little. After 15 days, take any food. It's fine. Okay, you can take any junk food to any food in the world. Second thing about hairs. For hairs, we prefer hairs are made of proteins and vitamins. Mainly zinc, copper, selenium are the main things that create the hair structure. And the sulfur and iron, these are the building blocks of hairs. So these minerals and certain vitamins like B12, it is also important, vitamin D3. So these are the things that you should look forward when you take a diet or a healthy diet. Okay, we have already mentioned one chart of diet. Okay, my team will also share you on a screen so you can note down that. So this diet chart you can follow. Maintain a good protein source. Okay, maintain a good vitamin source and fiber source. Okay, you can have anything like vegan, non-veg. Okay.
Yeah, I will be traveling abroad,
Okay.
and there will be less sunlight in winter. So,
Okay.
generally people take some supplements for sunlight less. So, what can?
See, you are traveling abroad. So whoever traveling abroad, at least they should get hair transplant done at least 10 or 15 days prior to. Because if there is any minor issues or side effects there, we can manage within those period. Majority people, if they do swelling or pain or any side effects, hair transplant within 15 days do develop. Later on, there are very rare chances any patient do any scalp related side effect or body related side effect. So that is the first thing. Now you are traveling to one area where the sunlight is very less. The ultimately, it's a good thing initially. Like first month we ask patient to avoid sunlight because those can directly damage the graft, the tissue. The tissue is open. It's not totally healed. During that the UV rays goes inside your head, then it might damage your roots. So, but definitely I will ask you to cover for 1 month. And if you are not going into sunny area, it's a very good thing. Second month onwards, definitely for your body you require vitamin D3. Okay, if you are having good diet but if there is no sunlight, then also vitamin D3 will be low. And majority of us now in the office we never exposed to sunlight much.
Yes.
So my take, whatever the area is totally not sunny, it will not happen. It is rare are the very rare places in Earth there is very zero sunlight like thing. So what I suggest at least have a 10 minutes or 5 minutes or exposure to sunlight in morning or evening.
Okay.
That is more than enough to create or form vitamin D3 in your body. So for vitamin D3 synthesis, 15% body surface area exposed for 15 minutes is more than enough. Okay. Have a good diet. I'm still, if you take your blood test once, if there are vitamin D3 deficiency, there are supplements take. We already always include 8 weeks of course of vitamin D3. You can take around 12 tablets, 8 every
Once a
weekly,
week.
and then every monthly once.
Okay.
Sure.
I have to avoid which generates sweat. Is it correct?
So there are two things. You can do exercise later on. 7 days before hair transplant you should avoid, and we generally avoid exercise for at least 15 days. If you are having a very heavy workout, then at least start after a month. Why to do this? Your body right now in a healing phase on the scalp area. If you do heavy exercise within 15 days or 30 days, okay, then the body will divert its focus from scalp to muscle areas. So that's why we ask to avoid. Okay, once this is healed, the shading takes place, then start your heavy exercise or routine workout. Second, exercise can do sweating, you can have head injuries, your scalp muscle will be contracted too many times, your facial muscles will be contracted too many times. So that can leave some problems in the healing phase. So that's why we ask patient to at least avoid for 15 days minimum. After that, gradually go for jogging, cardio activities, warm up kind of thing, and 30 days later you can do any exercise. With sweating also it's fine. So first 30 days sweating because of exercise should be avoided. Normal sweating will be fine. Okay. If you have a normal sweaty scalp, it's fine. It will not cause any problem to you. Okay. Sure.
Next one is about hair oils.
Okay.
Any particular type of oil like coconut or something I should use?
Yeah. So see, we Indians do have a fond of applying coconut oil or hair oil on a regular basis. That's a normal routine care. It's in our Indian culture. Particularly if you have a dry scalp, you can use any oil. It's fine to moisturize your scalp. Okay. For hair dryness, you can use any oil. Okay, that's a fine. But if you have a seborrheic scalp, like in your case, you have a seborrheic scalp, oily scalp, in that you are prone to develop more dandruff if you keep applying oil. So I will say avoid oils, at least initially for next 3-4 months. Later on, you can apply on your hairs when they are grown to a good length. The hair application is a difference, scalp application is a difference. You can massage scalp oil for at least 2-5 minutes, then wash next morning. That's the ideal culture. Tail malish or oil massage, that should be done actually once a week, and you can wash. There is no need to apply oil and keep it for 24 hours. It can promote fungal infection growth, and it can lead to dandruff, itching and pimples. So my take on is that you can apply any oil. If you have a dandruff prone scalp, then go for a tea tree oil. If you have a dry scalp, go for a coconut oil. These are the two best ones. Okay. Nowadays, people are also using rosemary oil. Okay, rosemary oil is a minoxidil substitute, or it works like a minoxidil in a lower manner. So you can try that as well if you want to boost the minoxidil result. It's an essential oil, so you need to mix in some serum or oil, and then only you can use. Once or twice a week is more than enough. Okay. Last thing, avoid oils for first 1 month. Once it takes healing phase properly, and then you can use second month onwards. Okay.
Every time I will use the day before shampoo night and next day.
My suggestion will be you are applying minoxidil at night.
Yeah.
So morning you can after wash you can apply some amount of oil.
Okay.
So it's better, and every second or third day will be better. Twice a week is more than enough. Depending upon your scalp type, it's too dry, then apply daily.
Okay.
It's too oily, then apply once a week, or you can avoid as well.
Okay.
Sure.
Any particular kind of towel I should use for initial month? Like you are saying, it is very sensitive.
Yeah, there is nothing to worry about that. The roots are connected within 5-7 days. Okay. Just don't do too much vigorous rubbing. Go gently. Wash with your hands and basic white shampoo. Tap dry in your scalp. Okay. If you find any issues like dandruff or itching, directly consult our follow-up team. So we'll directly guide you. Initially, we ask you to apply the baby shampoos from
Yes.
7 days to 15 days. 15 days later, we ask you to shift to anti-dandruff shampoo twice or thrice weekly. So that is more than enough. You can use any cotton towel, it's more than enough. Okay. There is no specific towel to be used. Any cotton material will be the best one to be in touch with the skin. Okay.
Yeah.
Sure.
After 7 to 10 days, I can use something like this after
Yeah.
to going.
These are surgical cap or bandana. You can say
okay.
we use every time, and these are skin friendly, hair friendly. So
Ah.
this is the best material, cotton material.
Okay.
If you don't have that option, then you can go for a simple hoodie cap or simple cap. Okay, don't go for a helmet for a first month because it will cause too much damage. So tight caps and helmet should be avoided. Any cotton related material will be fine. Even handkerchief we use
Yes,
that you
yes.
can keep, and then you can wear any cap on that. That is also fine.
Okay. Okay. Hot water. Is it good to have hot water or cold water? I'm not sure.
For a normal thing, as a normal scalp, always use cold water. Prefer cold water. If it is too much cold outside, the winter is going on, like you are in a sunny area or in snow-ridden area, then you can use hot water. It should be room temperature water. You
Yes,
put
Mix.
your hand in the water, it should not feel hot. It
Okay.
should feel cold or normal.
Normal.
Okay. If it's feeling hot, then it's a hot one. Avoid using hot water too many times. It will definitely damage the grafts and hairs as well. Okay.
Generally, about after shampoo, they use conditioner. So in this case, do we have?
Conditioner are meant for females mainly.
Uh-huh.
If you increasing your length to such length, then the whatever the hairs are coming out, the structure becomes weak or dry and frizzy. The keratin fibers will become loose, open up with a multi-time wash. Just like our jadu at home.
Yeah.
Initially, new jadu will look very shiny and good,
Yes.
but once we use it, it becomes rough. Similar, our hairs when it grows longer, then they require conditioning.
Okay.
Even the hair oil application of oil on hairs is also a conditioning.
Uh-huh.
On scalp, it's a nourishment, and on hair is a conditioning. So you can use any conditioner, it's fine. But once your hair grown is long, at least initial 3 months you have done hair transplant, you don't require any conditioner. Okay, if your scalp feels dry, apply 2-4 drops of coconut oil, more than enough. Okay. Later on, you can go for any conditioner, it's fine. There is no specific recommended conditioner. Okay.
About combs, basically, after 1 month, I normally use very thin lines of comb. I don't know if it is normal or.
So for combing, actually, I do ask patient to comb your hairs. Okay. First 3 months, you will not have too much growth. Initial first month, it will grow. Then it will shed it in 15 days to 45 days. 45 days to 90 days, you will see your bald areas only. And 90 days later, you can see baby hairs. That will grow in another 6 months. And you have a short curl, head curl. So first 3 months, I will ask patient to keep short trim look only. Okay. 4th, 5th, 6 months start to grow hairs, and once it eventually fully covered, and then you can start combing your hairs from 6-7 months. Okay. And style in a direction of clockwise bhomra. There is a roll pattern. It's a clockwise or anti-clockwise. So you can go like that pattern. Okay. And combing is actually good. It stimulates the blood circulation on the scalp. Use a fine teeth, okay, or white teeth comb, okay, and it should be a broad one, not the very very fine teeny one, and it should be smooth, okay. It should not hurt your scalp. Okay, you can comb for at least 2-3 minutes. It's a good habit. I ask patient to apply minoxidil, massage it, and then later comb it, style it, and then sleep.
Okay. While applying ice cubes, I was thinking of swelling, so I already applied ice cubes. When I was taking ice cube here, I was feeling something like pulling inside. I don't know if it is normal or is it.
See, you have gone through anesthesia. We have put so many new hairs over the front area. Though those hairs do have connection to the nerve supply as well, not only the blood supply. They are establishing connection now again in the front area. So initial 15-20 days you might have some numbness in the front area. Once the shading overs and new has come, then the sensation becomes normal. Backside you might find some pain or itching, rarely. Okay, but if you find, just contact our team, so we'll guide you some medicines. So these are the basic things. And ice cube definitely have a cold sensation. Okay, here you might feel the same, but in the scalp area it might give a little bit different sensation initially. Once 15 days are over, there will be no sensation. Okay, it will become normal.
I was applying only on the face because swelling was told to be here only.
Yeah, majority people don't get swelling. Even in case, I don't think you got too much swelling, right? Initially, we are getting too much because our anesthesia solutions are were such. Now we add certain selective solution in our anesthesia to reduce that swelling portion. Okay.
Okay.
So it's a secret for our clinics. We don't disclose, otherwise it's a patented thing. Okay. So we definitely get very less swelling nowadays. Okay, and it's very helpful to the patient because you can right now also start working. You are must be feeling comfortable. Initially, it was like patient used to take 10 days leave, 15 days leave. Even you were asking to go for a 10 days leave, but even 7 days you will be fine.
Similar to LASIK surgery actually. How they advanced this is also looks like.
Yes. There are micro improvements now. Macro improvements are already done.
Okay.
I hope the AI will help more.
Yes. T-shirts next month onwards I can, or next week.
You can wear now anytime. This T-shirt is only we ask about for next 3-4 days, because if you pull out the T-shirt, the grafts are loosely attached to the skin and blood supply. They might get removed. Now your grafts are settled. So after 7 days you can wear anything. It's fine. Okay, just gently put down. Okay, and it only you can go like this. Okay, rather than going up like this. Okay.
Yeah.
And polo T-shirts are fine from second day onwards.
Uh-huh.
Only those round tight T-shirt you should avoid.
Okay. Yeah. I guess that's it. Maybe sideways sleep I can do now all.
Yeah. See, if we create tempers now, that day we ask patient to avoid for 1 day at least. Now and second day onwards you can sleep on slide. It's just should not be bent over like this. Okay.
Yeah, these are all the questions I had was.
Okay. So I hope you have a better journey in future, and you are traveling at
next month after one PRP. I should be.
So who are the patients who are traveling? They are not from Pune or not from other cities or not from India. So for them, my one advice is that our team has one follow-up number. Just contact on that any day. Our doctors are always be in touch with that person in our team. Anu ma'am is there, who is looking after all the hair transplant follow-ups and everything. Just raise your queries there. We'll definitely answer majority of them, because these are the frequently asked questions. We have list majority in C knows, and few patients he thinks that our expertise is required. We definitely call you back as well.
Yeah.
Okay, so you'll get that support from there. Okay. So I hope that's a good one. Okay.
Yeah.
Thanks for contributing to our channel as well.
No problem.
Okay. And we have been you have been a very good patient to us, and definitely I hope we get very good results as well. Okay.
Sure.
Thank you.